In this video lesson, we will have an exploration of the prominent bony landmarks of the first cervical vertebra, C1, also known as the atlas. This is an inferior view, so we are looking at the underside of C1. For context, anterior is up here, posterior is down here. This is the person's left side, here is their right side. We will begin by first stating that there is a bony landmark that the atlas does not have. Anteriorly in the center, every other cervical, thoracic, and lumbar vertebra has a body. What would have been the body of C1 instead fused onto C2, forming the dens, also known as the odontoid process of C2. C2 is also known as the axis. So now here we can see the anterior arch of the atlas, and on it is the anterior tubercle. Down here we have the posterior arch, and in its center we have the posterior tubercle. The atlas is also unique in that it does not have a spinous process. Rather, in the center, posteriorly, it has a posterior tubercle. Out laterally, on the left and right sides, we see the transverse processes. In each transverse process, we have a hole, a transverse foramen. The transverse foramina, and the word foramina is plural for foramen, the transverse foramina of the cervical spine allow passage of the vertebral arteries. We have the vertebral foramen in the center of the atlas right here. The vertebral foramina of the cervical spine allow passage of the spinal cord. The vertebral foramina create the spinal canal. Now looking at joint surfaces, articular surfaces, we see the inferior articular processes, and on the inferior articular processes, we see the smooth, flat bone, which is termed the facet. We have two inferior articular facets here. The inferior articular facets of the atlas articulate with, form a joint with, the superior articular facets of C2, the axis which is directly inferior to the atlas. They create the facet joints. A more technical term for facet joint would be the zygapophyseal joints. We can also see a facet right here, smooth flat bone on the anterior arch. This is the articulating surface of the atlas that meets the dens, the odontoid process of the axis. So between the atlas and the axis, we have three articular surfaces, three joints, the paired facet joints and the joint between the atlas and the odontoid process, which is termed the atlanto-odontoid joint. This has been a review of the prominent bony landmarks of the atlas with an inferior view. Now that we've reviewed all of the prominent bony landmarks here, let's quiz ourselves. Pause the screen for a moment and see how many of the landmarks you can name.